My name is Claire Kittner. I am a physician assistant in the Dumoulis Center for Cardiac Arrhythmias at Massachusetts General Hospital. You are a patient in the cardiac arrhythmia service because you have a pacemaker or an implantable cardiac defibrillator, or ICD. Pacemakers are used to prevent heart rates from going too slow or to keep the top and bottom chambers of the heart beating in sync. ICDs are for people who are at risk for dangerous heart rhythms from the bottom chambers of the heart. Both pacemakers and ICDs use a battery or a generator to keep the device working. The battery life is one of the things we monitor closely through your device checks, and as with any battery, the battery of your device will become depleted with use. As the battery life lessens, we will get an alert from your device telling us when it is time to replace the battery. This alert will come with at least 3 months of battery life left, so we will have plenty of time to schedule the procedure. When it is time to change the battery or generator, you will be scheduled in the electrophysiology or EP lab. At the start of the procedure, you will be given some sedation or anesthesia to keep you comfortable, and you will be connected to some monitoring equipment to watch your heart rates and blood pressures during the procedure. An area on your upper chest will be prepped and cleaned, and then you will be covered with a sterile drape to keep the area clean. Your doctor will give you numbing medicine to an area on your upper chest and will then open the same incision from when you had your pacemaker placed. The old battery will be disconnected while leaving the wires or leads in the heart. A new battery will then be attached and placed under the skin in the same pocket. The incision site will be first closed with a layer of absorbable sutures that are under the skin. These will dissolve over time and will be absorbed by your body. You will not need to have any stitches or staples removed. Thin, white pieces of tape called steri strips will then be placed directly on top of the skin to bring the skin layers together neatly. A big piece of gauze and tape will lay on top of the skin to cover the entire incision. The tape and gauze dressing will stay in place for 5 days after your device is placed, so the area remains clean and dry. This may not get wet, so you must either sponge bathe, or if you have a handheld shower head, you can shower if you keep the shower head below your waist. You should not take a shower normally for these first 5 days, so the dressing does not get wet or fall off early. After 5 days, you can remove the tape and the gauze dressing at home. You will notice the steri strips underneath. These can get wet and will curl up and fall off on their own over the next 1 to 2 weeks. You may get in the shower once the dressing is removed. Wash the area by letting the soap and water run gently over your skin. Don't directly scrub at the site or pick off the steri strips. After showering, keep the skin clean and dry and avoid using powders, moisturizers, ointments, or lotions on top of the area to avoid irritation and infection. An additional point we want to make to avoid infection is to avoid submerging the site in water for 1 month. This means no swimming, baths, hot tubs, lakes, oceans, or pools. On the rare occasion, staples may be used to close your incision site. These staples will be removed 2 weeks after your procedure at a follow-up appointment. You will then have a second follow-up appointment 6 to 12 weeks after your procedure. You will receive specific instructions regarding your type of device dressing and when you can get the site wet before you are discharged. With generator or battery changes, there are no arm restrictions afterwards, compared to when you had the device first placed. It is normal to have some discomfort at the incision site for a few days after the procedure. We recommend Tylenol for the pain, but in some cases, you might require a prescription for something stronger. We will also review your medications and when it is safe to resume these. We typically hold blood thinners for a few doses before and after the procedure. This will be decided by your doctor based on your case. If at any point in the next few days, weeks, months, or years, you see any bleeding or pus at your incision site, any redness, swelling, or if you have fever, chills, or night sweats, these could be signs of bleeding or an infection. The sooner we treat that, the better the outcome. You should call the office or the device clinic and let us know. We would rather you call us every day if you are worried about something, rather than waiting to see if it gets worse. Also, in terms of infection, we recommend no dental work unless it's an emergency for 3 months post-procedure. The mouth has a lot of bacteria, and we like to eliminate the risk of this bacteria getting in your bloodstream and causing an infection. Please postpone any routine cleanings or dental work you have scheduled. If something emergent happens, for example, if you break a tooth, need a root canal, etc., please tell your dentist you have a new device and need antibiotics to protect you. After the first 3 months post-procedure, these antibiotics are no longer necessary. After your battery is changed, it will still be paired with a monitoring device of some sort, just like your previous device. This may be a phone app or a monitor you will keep next to your bed. Your device will run self-checks on itself in the middle of the night. Your monitoring system will then download these checks, save them, and if everything is stable, it will send us a report every 3 months. If the monitor notes an abnormal value or detects that there is something wrong with the device, it will send us a report sooner. We will call you if we see something that needs to be addressed. No news is good news in terms of your remote transmissions. Of note, if you have a defibrillator and your device shocks you, we will get an alert, but only after this episode has been retrieved by your monitor. If your device shocks you, you should always call us and go to the emergency department. In these cases, we would want to determine how we can hopefully prevent you from getting shocked in the future by either changing your medications or with a procedure. Be sure not to drive after you receive a shock until you speak with a provider from our team. This is for your own safety as well as others. You will most often be discharged right after your procedure. Since you will have received some sedation for the procedure, you will need someone to come pick you up from the hospital as you will not be able to drive home afterwards. You typically cannot drive for 24 to 48 hours after your generator change procedure to protect your incision site. Your doctor will discuss your specific instructions with you before you are discharged home. After you are discharged, you will come to the device clinic a few weeks after your implant so we can check your wound and make any necessary changes to the device. Until this appointment and after, the home monitor or phone app will let us know if everything is stable with the device. If you are having any symptoms, please call the office. If you have any general questions, you may call the office at 617-724-4500 between the hours of 8:30 a.m. and 4 p.m., or you can send a message through Patient Gateway. Please note, we do not check Gateway messages overnight or on weekends.